Obesity and cancer, the risk most people never think about. Imagine this. If I asked you what obesity can cause, most people would say diabetes, high blood pressure, heart disease. But very few people would say cancer. Yet, obesity is now one of the leading preventable causes of cancer worldwide. In fact, excess body fat has been linked to at least 13 types of cancer. So the question is, how can simply carrying extra weight increase the risk of cancer? Let's find out. First, we need to understand one important fact. Fat is not just stored energy. For many years, scientists thought body fat was simply a storage depot. We now know that's not true. Fat is actually a very active organ. It constantly produces hormones, inflammatory chemicals, and signals that affect the entire body. And this is where the problem begins. Reason number one. Chronic inflammation. When a person gains excess body fat, especially around the abdomen, the body enters a state of low-grade chronic inflammation. Think of it like a small fire that never completely goes out. You may not feel it, you may not see it, but over many years, this inflammation can damage cells and DNA. And damaged DNA is one of the first steps toward cancer development. Reason number two. Increased hormone levels. Fat tissue can increase the production of certain hormones, including estrogen. Higher hormone levels can stimulate cells to grow and divide more than they should. This is one reason obesity is associated with cancers, such as breast cancer and endometrial cancer. Reason number three. High insulin levels. Many people with obesity develop insulin resistance. The body responds by producing more insulin. Insulin doesn't just control blood sugar. It also acts as a growth signal. High insulin levels can encourage abnormal cells to survive and multiply, and that's exactly what we don't want. Now let's talk about the cancers linked to obesity. Research has shown increased risks for colorectal cancer, breast cancer after menopause, endometrial cancer, kidney cancer, liver cancer, pancreatic cancer, esophageal cancer, and several others. But before anyone gets worried, here's the important message. Being overweight does not mean you will definitely develop cancer. And many people with cancer have never been overweight. Cancer is a complex disease with many causes. However, obesity is one risk factor that we can actually do something about. And the good news is that you don't need a dramatic transformation. You don't need to lose 30 kilograms overnight. Studies show that even modest weight loss, combined with regular exercise and healthier eating habits, can improve metabolic health and reduce harmful inflammation. Small changes, repeated consistently, often produce the biggest long-term results. So next time someone tells you obesity only affects the heart or causes diabetes, remember, excess body fat can affect nearly every organ in the body, including increasing the risk of several cancers. Your weight is not just about appearance, it's about long-term health. If you found this video helpful, please like, share, and subscribe. You never know who might hear this message and decide to make a change that could benefit their health for years to come. Thank you for watching.